Increasing your cardiorespiratory endurance can lower your risk for heart disease and stroke by lowering your resting heart rate and lowering your bad cholesterol levels. It also lowers your risk for prediabetes and type 2 diabetes and lowers your risk for cancer by stimulating hormones, anti-inflammatory agents, and immune responses. Studies show that either medium or high cardiorespiratory fitness can lower your cancer mortality rate by 20 to 45%. Cardiorespiratory endurance is the measurement of how well your heart, lungs, and muscles keep your body active over an extended period of time.
Exercise has positive mental health effects. In one study, a 12-week aerobic fitness program, both men and women showed improved results in anxiety, stress, mood, and depression. And overall, their physiological health improved for over a year.
Was to increase the distance we could run by 25% within 3 weeks' time. The great thing about increasing your cardiorespiratory endurance is it doesn't require any extra equipment to do it, and you can do it anywhere. Also, it increases your muscular and bone strength while decreasing the risk of knee osteoarthritis. That's why we chose running as our main form of exercise. So the plan is that we're gonna use the 10% rule, where you increase either the intensity or the distance that we run each week.
Okay, so for some tips for a proper running form, one of the main ones is that you should always maintain a short, quick stride and try to avoid overstepping and overstriding because that could increase the risk for injury. And along the same lines, always make sure that your knees do not reach over your foot too much, and make sure that they're directly over because that can help you run more effectively and efficiently. And you should always try to push up and off because that will help you lessen injury and help you run faster and better, as with the other 2 points.
Be sure to watch out for your elbows. Make sure they are kept at a 90-degree or less angle. And then keep your hands relaxed and don't punch the air, and make sure they do not cross your midsection.
The 2 main alternatives to running are swimming and cycling, both of which are intense cardio workouts, but they put less strain on the joints, which makes it easier for someone to recover while still maintaining a proper cardiorespiratory workout.
So my personal goal was to be able to run a 10K by the end of the semester. So to do that, I'll be running 3 times a week. So far, I've been up to 2 times a week, but if I just keep that pace and increase it, I should be able to reach that. Also, just to see where I was at, I ran a 5K and I timed myself at 30 minutes. So I think that's a good start, and then I can try and reduce the time from there.
So my personal goal was to run a 5K comfortably without stopping by the end of these 3 weeks, and in order to do this I was going to run 30 minutes an hour at least twice a week, and so far I feel like I've been pretty successful in doing that, and I will be able to reach my goal by the end of the semester and run a 5K in decent time. So my original goal was to run a 5K in under 24 minutes. I was successful at running a 5K, but my time was a little bit over 28. So moving forward, I'm going to focus on increasing my speed rather than my distance, and go at the same pace by 10% a week.
So my goal was to run a half marathon by the end of the semester by training doing 5 miles every day for 5 days. I so far have been on pace with that, either doing cross training during those times when I can't run or getting up earlier and running. And I feel really confident that I can complete a half marathon by the end of the semester.
To run 2 times a week after work on Mondays and Fridays, I was able to lower this time to average 30 minutes per run. But most important of all, now I feel pretty good through the race. So I plan to incorporate this exercise plan into my routine and eventually get it to the 25 minutes.